A warning from a medical doctor about heat strokes this summer as meteorologists forecast hotter days. Family physician Dr. Linton Little says lots of fluid must be consumed to prevent heat strokes. Here's TVJ Shamela Pullen with this evening's health report.
The health report: heat stroke, also known as sunstroke, is caused by your body overheating. This can occur if your body temperature rises to 104 Fahrenheit or higher. Family physician Dr. Lincoln Little says this is not something to take lightly, as the condition can be life-threatening.
Because of the high temperature, it causes certain symptoms in terms of headache, in terms of hot, dry skin, in terms of patient becoming fatigued, muscle weakness, in terms of them getting unconscious. What it does, it dry out your skin, and because it dry out your skin, it causes a level of dehydration, and that level of dehydration can affect your kidney, affect your brain, and of course the extreme case leading into coma and then.
Anyone can develop heat stroke, but several factors increase your risk. These include age, diabetes, and persons who drink a lot of alcohol.
Number one is heat. So basically, if a patient is exposed to excessive heat, what you need to do, you need to cool the body by using fan or using AC, cool water. In extreme case, you have to use ice cold water. Immerse the patient, and of course those who are unconscious, you've got to replace the fluid, maybe by IV, or if they are conscious and they can consume oral fluid, that would be good.
Dr. Little says heat stroke is predictable and preventable. Therefore, persons need to take the necessary steps to avoid heat stroke, especially in the summer.
Make sure most of your outdoor activities are done in the morning and evening. You must wear loose clothes during the hot season. Must also make sure that we drink a lot of fluid, and especially athletes who are going to exercise. It is recommended that sometimes you drink at least between 750 ml of liquid up to 1 liter before you start 2 to 3 hours before exercise.
With your health report, I'm Shamela Pullen, wishing you good health. The health report